When we looked at the efficacy of combining Napabucasin with Gemcitabine Nab-Paclitaxel, one of the most interesting findings was to see a response rate close to 55%. In a disease where you rarely see responses, as an example with FOLFIRINOX and highly selected patient population, the response rate was 31%. So there was a very promising signal. We had 2 CRs on that study, complete responders, which you rarely see in this disease. About 40% of the patients had drops in their CA19-9, more than 90%. More interestingly, is those responses tend to happen and they tend to be durable, with some patients skipping the 1 year on treatment, and actually we have a couple getting close to the 2 years line on therapy. So a lot of interesting activity. Preliminarily, when we look at the maturing progression-free survival and overall survival, they again look higher than what would be expected for the combination of Gemcitabine and Nab-Paclitaxel. Then we looked at the safety, which was one of the primary endpoints of the study, and it appears that Napabucasin does not add to the toxicities of the chemotherapy regimen itself. There are additional GI toxicities, primarily some diarrhea, but these tend to resolve within 20 to 24 hours after stopping the drug and then readjusting, or with just supportive care. And it's a learning curve, like with all these new first-class agents. You tend to learn, so the first patient or two, you figure out what to do, and then after that, we found out, at least in our experience, that it becomes very easy to manage, and most of these patients actually do extremely well on the treatment.